So we're going to talk about a vibracussor. This is a unit that has some unique qualities. Vibrators by general, they are lateral, they go like this, and they're pretty much superficial, which is good. It gets blood in there, and it talks to the muscles, and it wakes things up in a nice way. This is a vibracussor, and as you see, it goes up and down. There is a little bit of sway in it, but mostly it's up and down. So what we're doing is we're percussing the muscle in a way where we can control the amount of power that we put through here. So what we're doing right now is opening up these areas and we're flushing. I'm flushing this up. Now, the lower it goes, the deeper it gets. Why? Because if you go real high, the body's going to start to push against it. Because remember, the proprioceptors are telling your body what to do. So if the muscle is being compressed, it's going to start to fire up. So right now we're using this at a medium level, and we're flushing the muscle group out. We're flushing it out, and we're getting into this area right here with the neck and shoulders. Because the important thing is getting the head. Remember, heads weigh a lot of weight. An anterior head translation, we made a disc on that some time ago. We'll show you at the end of this video. Anterior head translation is one of the biggest problems for our low back, because the heads weigh a lot of poundage. Gravity has it. I'm going to ask you to look over here. Here's the straight. The head goes forward, and suddenly the load gets too much on the low back, and over a period of time, that's what happens. That's because everybody's sitting there with their computers and looking like this. Now I'm flushing out the muscles. I want to flush them out to get the lymphatics to work. Now there's three things that we have in our body. Our heart pumps the blood. Anything that doesn't fit in the bloodstream goes into the lymphatics. What pumps the lymphatics is muscle contraction. In other words, if you don't use your muscles, you have all of that lactic acid build up in there, which causes pain and discomfort. What we're doing right now is gently talking to the system and flushing, as you see, the system out. Now, I also want to stimulate this area. Cerebral spinal fluid is coming from down here in the sacrum, so I'm going to turn this way up here and give this person a wake-up boost. I'm going to help him fire up better energy in his body. So this is a very nice unit to utilize because you can do multiple things with it. Now, for those of you who would like to do acupuncture and you don't have the needles or you don't want to put a lot of time in there, you're going to ask the patient to put all their fingers together, like so. I'm going to take their fingers like this. I'm going to put the unit right on their fingers, and we're stimulating all kinds of neural pathways into their brain and their body. It's a really nice way to do it. You do it in both ways. Okay? So I'm showing you how you can actually stimulate. Now I've got a higher situation here. I'm now waking up the muscles. Before I was flushing them. Now I'm waking up the muscles and getting the fire better. So the person will stand up and stand up straighter and feel better.